Welcome to our medication as the number one cause of toxicity.
So this is the third webinar that we have for our 4 webinar series.
And we're going to be sharing some secrets from the book that I co-wrote. So Dr. Amar and I have a lot of information, and the whole goal, our mission, is to get you healthy, live a great life by following the 5 fundamentals.
And we've done webinars and presentations on household products, toxic cookware, tap water, and heavy metals we're going to discuss for the next webinar. And then, of course, the toxins in our food was the first big seminar that we did for our Detox Project series. So you have access to all of these through our website. So make sure you go online and browse for those.
You know, let's put this into context here for people, because they come to see us a lot of times for the side effect of medications that they're taking. So an example is headaches. And so there was an Australian study. They had 330 people that they studied. They were taking 549 medications. And what they did was they looked for people that were coming in that had headaches that could be a side effect of the medication. So out of the 330 people, 104 different medications were identified. 69 of those actually had headaches as a side effect. So in fact, of the 330 patients, there were 57 people that were seeking the care from a chiropractor, and that they might have been seeking that because of the actual side effects, if you want to call it that, as headaches of the medication they were taking.
One thing we want to mention is we're not saying don't take medications or stop your medications. We're just saying that do your research, make informed decisions, talk to your pharmacist or medical doctor if you do have questions about the medications and the side effects, because they're the ones that know a lot, and they're the ones that you should be asking before you actually start medications.
And our whole goal is to help you be no longer need your medications, or at least reduce the amount of medication you're taking. And we're going to show you how we do that coming up. So we had Dr. Phil Narini at our second annual Food, Health, and Wellness Forum with Dr. Amar, and it was interesting what he started with.
Yeah, so if you go online, we're going to give you resources. You can hear what he has to say about medications himself, being a doctor that prescribes medications. And we're gonna tell you what he had to say about the leading cause of death in Canada.
Yeah, he started off with the perspective of he wants to help people get healthy, and most people think the leading causes are heart disease, cancer, diabetes, and so on. But in fact, the reality is like he said in red there, what nice doctors do to you. And they're not intending to do this, but really the third leading cause of death is from taking medication or being in the medical system with errors. And this is really just counting errors in a hospital. That's what the stats are reported to be, that many authors are saying they're much higher. We'll send the links. The Journal of the American Medical Association, I was just looking for the link, and they took it down. It's in their archives, so you have to be a paid member, but it's still in the British Medical Journal.
So again, if I ask you this, how many people are dying from hospital errors in the U.S. and Canada per year? What would you say, Dr. Phil?
Oh, I know it's a lot, but I mean, the stat that I know you have is crazy.
Yeah, so it's 25,000 a year, and that's actually decreased because we've all heard of, errors back in the day where, the wrong limb would be operated on, and they started labeling the right limb. And so if this has gone down and there's still 25,000 a year, to me, that sounds quite scary.
Yeah, I mean, more people are dying per year of medication or related deaths than there were per year in the World War I and World War II, to put that into perspective.
And that's the other thing too. There's more and more money spent on prescription drugs, so 29.4 billion in Canada. So we know there's more money being spent on healthcare, but more and more people are using medications. So to me, that doesn't make sense. That's not really healthcare. It's more disease management. And again, you do need disease management, but what about real health or true healthcare?
Well, what do you think OHIP's plan is, and what do you think the medical plan is in Canada or Ontario for this? Do you think they're going to start decreasing, Amar?
So that's the thing. So if you look at what Health Canada has to say, so we can send you a link with this information as well, their solution for healthcare is better medications. And to me, being on medications is not healthcare, like we just said. So if you think about the fact that now kids under 25 are getting, prescription drug coverage, people think that's great, but I personally wouldn't want to be on medications if I was less than 25 or on meds, period, if I could avoid them by doing these lifestyle 5 fundamentals that we're talking about.
And in context, over the last 10 years, the amount of drug use has doubled in Canada and the US. So what we're saying here is that, and it's not even us, so let's take a look at Dr. Peter Bregan, and we'll send you the link for him. And he talks about psychiatric medications as, he actually has a book called Toxic Medications. And he describes how that there is, for anxiety, depression, and so on, and our teenagers and children are largely being prescribed these medications, which cause, he says, suicide, shootings, violence, nausea, insomnia, anxiety, later on decreased sex drive, fatigue, hormone damage, headaches. So, and then when you get those side effects from the one medication, what do they do in the medical system for the next symptom?
So I'm sure some of you have experience with this, first-hand experience. They'll prescribe more medications to cover those side effects from the initial medication. And another thing is we've seen a lot of people lower their doses in our practice, get off of medications, whether that's antidepressants, sleeping medications, high blood pressure, and a lot of people experience a rebound effect. So what happens is if you're on antidepressants and you go off safely with your pharmacist, medical doctor, you'll have that depression coming back sometimes twofold, so worse than before, but we don't tell you about this. So
we're going to help guide you. Stay tuned for the end of the presentation where we'll guide you on exactly what to do if you or a loved one needs to decrease or eliminate your need for medication.
And again, we do that safely with your medical doctor and your pharmacist because it's their scope of practice and they're the ones that have to actually legally tell you how to decrease that dosage. So how many side effects do most drugs have, Dr. Phil? What do you think?
Well, I know you said this at our resolution seminar, and I was actually shocked that it was 70. Dr. Hyla Cass, she actually states, and we'll give you the link for this, that it's not well known, but potentially life-saving fact that common medications, one of the reasons that they're toxic to your body is because they deplete your body of a host of vital nutrients like minerals and vitamins. And so we'll send you the link on that.
And the other thing is taking 2 medications doesn't necessarily mean 140 side effects. It can be synergistic, so it can be 200 side effects when it's 2 medications combined. So again, this is another thing. We sometimes patients come in and we say, have you talked to your pharmacist about what you're experiencing? Is it a side effect? Do you know? And people aren't sure because research hasn't been done to show interactions.
That's the exact point.
There's a lot of medications.
There's no research on that. They've never studied 2 drugs together and how do they interact and make you worse. So, the most alarming thing to me is actually with children. And, they're in Canada, so they studied 1 million children on medications. Antibiotics, respiratory drugs, psychotropic drugs were the most common. And 6% of all the kids on drugs were on what they call psychotropics for mood or behavior disorders. And what the shocking part is, Dr. Amar, you better tell them. So
again, how much research has been done to show that these medications are safe or effective? You could essentially virtually say nothing has been done, so we don't know what these drugs are doing to our kids long term or short term. Yeah, like from a safety perspective, if you want to call this a side effect, and I guess it is classified as such, but just from a psychotropic drug like a mood or mind altering medication for behavior, you take a look at these drugs listed in the slide here. And so what happens is that the weight gain is a side effect or a cause of the drug, diabetes, high blood pressure, high cholesterol. So these things are happening, and they're saying that they're vastly underreported. This is actually right from the Canadian government website. And then, a lot of people come in, so Dr. Amar, you're pointing to me here. I'm glad I haven't taken too much ibuprofen because, anyway, I won't go there with that joke. But unfortunately, they took a bunch of young male athletes and they're actually becoming infertile. Infertility in men is becoming much more common. And you wouldn't think that something like ibuprofen could do it,
because we see people coming in that are on what they call non-steroidal anti-inflammatory drugs or NSAIDs. So Dr. Amar, they come to us all the time for that, right?
Yep.
And so people don't know these side effects exist. Another common one that they're coming to us for are muscle aches and joint pains. And so Dr. Sinatra says in his Great Cholesterol Myth that these are side effects, like having these muscle aches and pains, and they're side effects of taking cholesterol medication. We're supposed to have, the fats are supposed to be in every cell of our body, and in fact, those fats are making our hormones. So we just want to let you know that, our goal is to help you reduce or eliminate the need, and that produces overall health.
And we talked to you about with our other webinars, what types of fats you need in your diet. So make sure you're meeting your requirements for that as well.
And just before we go to the next slide, I want to just talk about the fact that the medication has not been proven to actually decrease, like cholesterol medication you would think has been proven to decrease mortality, or like you're gonna not die if you take the medication. And the fact is, it hasn't been proven effective for any woman, and there's only very few. So the majority of men, it's proven not effective for either. Yet they know about all these side effects and all the problems with them, and they're still prescribing them. And so, anyway, that's not our words. These are the words of other cardiologists, and those links you'll see.
And there's other ways that you can lower your risk for having a heart attack or prevent it. So when we have patients tell us they're taking aspirin and they're taking statins, medications to decrease their risk, we always talk to them again about lifestyle and what you can do to lower your risk for something like a heart attack. And
that's so true. Dr. Ornish, who's a cardiac surgeon, says 99% of heart disease is reversible. That's a crazy stat, and I don't think people know that.
Well, it's hard to believe it too if you hear it. So
we're not going to really go into detail about vaccinations. It's not our scope of practice. The reason why we're even bringing it up is because people are asking us all the time about what do you recommend for us? Well, we're not going to tell you what to do, but we are going to tell you that we want you to be informed and make a good informed decision. There's a bunch of groups out there. There's Physicians for Informed Consent. There's a group of nurses. There are organizations in Canada and the US, and we will provide the links. From my perspective, it's the toxins that we find in the vaccines that I want to just discuss for a moment here. So it's the mercury and the aluminum that are found in not just vaccinations, but there are other drugs that have it, household chemicals that we talked about, you can see on the slide with paint toys that kids could be playing with that have lead in them and so on. With respect to the toxicity of aluminum in humans, there's much research, so we're going to send you these links. PubMed is actually, it's a resource in the U.S. It's the National Library of Medicine, basically, an online that you can go and search this stuff yourself. And what they talk about is that, aluminum is devastating to your central nervous system, and of course, that's what we work with. And they talk about that it's found in the vaccines and how it's causing all sorts of havoc, including autoimmune diseases.
So again, we always say we support whatever decision you make, but make sure it's an informed decision. So have a conversation with your pharmacist, your medical doctor, and then decide what you want to do. Because we've had parents where they felt like they weren't fully informed and they wish they had known more information. So again, it's about you educating yourself.
Perfect. And there's just another research article talking about, an immune deficiency from the actual adjuvants, which are the chemicals that they use in the vaccines. Just as a side note, I think the idea of a vaccination is a really good one. You give the body a little dose of something that it's going to memorize and then make white blood cells to be able to fight it. But the problem is that, it's not just that's there. And so they have all these chemicals, and again, as you've been following our webinars, it's these chemicals that are causing health problems.
Right.
All right, so let's go on to now what do you do?
So again, we have a lot of people come into our office and they tell us, I have this backache, neck ache, whatever it may be, and I'm using Voltaren or I'm using, I think, A35 rub. So there's always alternatives. So what we do is we make our own little blend of coconut oil and peppermint oil. So if you use that, that's going to help reduce inflammation and pain in the area. A lot of people, come in because of pain. So again, what do most people do? Like I used to take Tylenol or Advil. And people don't know there's natural and healthier alternatives such as turmeric. So again, turmeric, there's a lot of research to show that it decreases inflammation, but it also kills cancer cells, which is, that's amazing. I take it for prevention every day, but if I'm having aches and pains, then I'll dose up on it. And then of course for things like headaches, muscle cramps, aches, sleeping issues, a lot of us will take magnesium. So again, come in, talk to us, talk to another healthcare practitioner prior to taking any of these because we want to make sure you have safe dosage as well. But there's always alternatives. So again, if you have questions, just let us know and we'll give you that information.
That's excellent. And when you take the natural forms, then what happens is that you avoid the degeneration you see in this slide of the knee. That's actually the cartilage. And so if you've ever eaten chicken, hope I'm not hurting any vegetarians' minds here, but if you've ever eaten chicken and you see the white cartilage on the end of the bones, that degenerates and wears down like you're seeing in this slide. And that happens when you're taking those medications, the medical kind, even the over-the-counter, is they're never going to help you repair, but there's some research that's showing they can help degenerate. Even though you feel good at the time, it's making you worse. Whereas the turmeric curcumin, like Dr. Amar said, it's actually helping you to decrease the inflammation in a way that actually helps rebuild the joint, which is a wonderful thing. And I just want to show you, as we see in the spine here, this is a picture of the lower back from the side, and this is severe degeneration. And these are pictures here that you'll see in the neck. And then we help people in fact, our care helps reverse arthritis, which I don't think people even know is possible. So we help reverse arthritis, and of course there's work for people to do to get there, but it's very important. And so our whole goal is, if you remember that bucket principle we talked about.
So again, it's not just, let's just get rid of these toxins completely. You have to do certain things to minimize your toxic exposure. So, researching before you're taking medications, watching what foods you're eating, what products you're using for cleaning and makeup. All of that's so important because we want to make sure that your bucket's not overflowing and you're actually building health, not disease.
And the biggest thing in the bucket we find, though, generally when people are coming into us in bad health, is that their bucket's full from the medications. And so not only are we going to help you not fill it, like Dr. Amar said, but we're going to help take the plug out so you can get rid of them, the toxins.
And the other thing is, it's individual results vary, basically. So, with some people, their spine has a lot of degeneration, a lot of wear and tear, so it will take them longer to detoxify or get to where they want to be with their health goals. But if we start as young as kids, for example, we have babies coming into the office getting their checkups, we know they're going to heal faster, and that's going to help them long term. So that's why everyone should basically follow these principles, in our opinion.
And there's a lot of research showing this. And when I took my certification through Harvard Med School, you can see that here's a lifestyle medicine article. They talk about us getting to the actual cause, not actually managing the symptoms or the condition or the disease like Dr. Amar mentioned earlier with a medication or surgery, but actually getting to the cause is the only way, and that's what they like to call lifestyle medicine. So there's some support. There's a couple of articles here. And then we have a support from a psychiatric support through Dr. Bregan, and he's got this book called Psychiatric Drug Withdrawal. And so we use these as our guidelines. So when you see the letter, when you come in and you're interested in doing some work and you've got some commitment to get healthier and follow our recommendations for the 5 fundamentals, then we can write you a letter to your medical doctor. And of course, we want you to bring it to your pharmacist, like Dr. Amar said. So that letter, basically, we need to get from you the name of your medications, how long you've been on them, your MD's name and the contact. And so when we give this letter to your MD, I wouldn't want to say off the hook, But if they don't prescribe a medication and you have a condition or a disease and you have trouble from that, they're liable. So their board basically says, this is what is supposed to happen. You're supposed to put them on the medication. Unfortunately, they don't get training in nutrition or exercise or our lifestyle, improvements that we do here. And so they're not going to sit down with you and make sure that you know this. That's why we do these seminars, so you can understand, these webinars, you can understand how you're going to get healthy. And we guide you in the office on how to do it. So take a look at that letter. And you take a look at somebody like Dr. Greger, and you see what he says is that people wildly overestimate the effectiveness of drugs for helping people live longer and better. He says treating the cause of the disease is what is necessary. We'll include the link on some YouTube videos that he has that is basically summarizing his book called How Not to Die. Sounds good to me.
Yeah.
So I think we could close with one of my favorite quotes from, I guess, the father of medicine, as he's the father of modern medicine. So Dr. Amar, what do you think about that?
Well, he says our food should be our medicine and our medicine should be our food. And he also says, look well to the spine for the cause of disease.
I like those quotes.
Same here.
All right, so we're looking forward to seeing you on the cruise ship and not the nursing home. And that's where our 5 fundamentals will take you.
And if you have questions, comments, feel free to comment below or send us an email, and we'll make sure we get back to you as well. So stay tuned for the next webinar as well. So that will be about heavy metals and water. So stay tuned for that as well.
Bye.